So 27.8% of rural residents smoke, compared to 22.7% of urban dwellers. This trend is consistent for males and females up to age 64. Rural young adults, 18 to 34, smoke at especially high rates and are 27% more likely to smoke than their urban counterparts. And if you think about the 18 to 34 age group, that's where my brother falls in line. That's where, for 5 more days, I fall in line. And this is the age group where most of America finish their education, start families, start working. This is the age where we really need to cut tobacco use off. We need cessation efforts. We need the prevention efforts that we did in schools to have taken effect so that they never start. So this age group is very, very important to the health of our nation. And ultimately, we see in rural residents, this age group smokes at a higher rate than the rest of urban and suburban areas. Men are far more likely to use smokeless tobacco, and those from rural areas are more than twice as likely to use these products as those from metropolitan areas. When looked at by age, smokeless tobacco use was more than twice as common in rural areas for every age group. Let me repeat that. Smokeless tobacco use was more than twice as common in rural areas from every age group. So, while both cigarettes and smokeless tobacco are being used, and that's called dual use, it was quite low overall and twice as high in rural areas. So it was quite low overall at 1.4%, but still twice as high in rural areas, so it was 2.5%. So those people using cigarettes and smokeless tobacco. Starting young and smoking more, on page 5. The long-term impact of tobacco use is determined by how young a person is when they start to use tobacco products. Both of these factors not only increase the body's exposure to cancer-causing ingredients in tobacco products, so it makes addiction more severe, making it harder to quit. In a recent study, youth who live in rural areas were 3 times as likely as both urban and suburban youth to smoke. That's a key finding for us in a recent study. Youth who live in rural areas were 3 times as likely as both urban and suburban youth to smoke. Among children living in rural areas, those who smoked a full cigarette before the age of 12 were twice as likely to become young, regular smokers as those who started experimenting at a later age. Overall, 37.4% of rural adolescents were considered regular daily smokers, which was significantly higher than both suburban and urban adolescents. Rural smokers are less likely to consume fewer than 6 cigarettes daily and more likely to consume more than 15 cigarettes a day.